Okay guys, I decided to do a video here in my opinion. I'll state that right off the bat, showing kind of how you can find out a little bit maybe about the Healthcare Affordable Care Act. I just went to healthcare.gov and this opened up. I'm not going to apply online or by phone because they claim that it's not working, but it allows you to see plans and pricing in your area, so I can just kind of see how it affects me. So I'll click on that. And I'm going to go to which best describes you. You got to answer some questions. And I'm looking for coverage for myself or my family. Next. I want health coverage because dental coverage, it says here, may be included in some plans. In some cases, separate standalone plans will be offered, so it doesn't tell which ones that they're included in or whatever. I'm just going to go to health. Select a state. Go down to Wisconsin. Select my county. Rock. And for me, my spouse, and my children is who I want to apply for the health care coverage, or I'd look for. This is just a little bit of blah, blah, blah. All plans must offer the same essential health benefits. Tells you that. Next. This tells you that some people can qualify for lower costs via a tax deduction depending on the number of people in your household and your income level. And I fit here, so I'm going to hit next, keep going. There's the 5 categories. Catastrophic, bronze, silver, gold, and platinum. Now, I've never heard of catastrophic. I only heard there was bronze through platinum. So I guess this is something maybe a little new. But I'm going to hit next. And that brings up 33 health plans for those few things that I put in for criteria. And then you can click on either one of these boxes and it'll only bring up those packages. So if you're interested in looking at a platinum, just for easy simplicity here, we'll go with this. I got a Dean Safety Net catastrophic plan here for $447 a month. And then of course they go up per month from there. Kind of crazy. Just out of curiosity, if this is the lowest plan right here, here's what a platinum would cost me. There's 3 platinum plans. Yeah, I can't afford that a month. So, click on all plans here. In order to find out if I qualify for lower costs, I'm going to use a simple calculator here. So, here we go. Now, keep in mind, again, I'm on healthcare.gov. So I'm not on any right-wing Republican website. This is the website. It says here, visit the Kaiser Family Foundation website to use the health insurance cost and savings calculator. Now this is embedded. It's linked right in with the healthcare.gov, so it's a plausible deal. So I'm going to click on it. Now it takes me to the Kaiser Family Foundation to put in my information to find out if I qualify for a subsidy. Select the state. Of course, I'm going to select my Wisconsin. Do my zip code. I'm going to enter my income in as dollars, not percentage of poverty, because I have no idea what percentage of poverty I am. So annual income. Now, keep in mind, it says you have to enter the total annual household income of the taxpayer, spouse, and your dependents. Okay, so if your kids live at home and they work, got to enter them in too. Then it asks, is your employer coverage available? Well, in my case, yes. Both my job and my spouse's job offer insurance. We got notice from them 2 weeks ago that stated that if they offer a minimum base plan, of which they both do, we do not qualify for a government subsidy to help bring premiums down if we so choose to go to the Affordable Care Act. Okay, so I'm going to put no in here. And I'm going to put no in here simply because what if my employers both drop us? I need to know what I'm going to be up against. Number of people in the family, of course, 4. Number of adults over the age of 21, 2. And now it's going to ask me about tobacco use. So this is the first portion of where they're going to start getting in here into your life. Hopefully they're not discriminating against people because they smoke. Couldn't imagine them changing the premium because of it. Okay, use tobacco? Yes, unfortunately, both of us do, along with the other millions out there. So I guess we're going to be two of the multiple millions out there that are going to quit, right? Number of children 20 and younger, 2. How many of them use tobacco? 0, because they're under the age of 5. I certainly hope to God they're not using tobacco. Okay, submit. It's going to give me my results. It says that I'm 293% of the poverty level. And I guess I'm not that rich. $69,000 a year. I guess I'm rich as heck, man. Maximum percentage of income you have to pay for non-tobacco premium if eligible for the subsidy. And 9.3% before accounting for tobacco surcharge if applicable. So there's a tobacco surcharge. Or could be. Health insurance premium in 2014 for a silver plan before the tax credit would be $9,002 per year. Now, there's a tobacco surcharge of up to 50% of your total premium before the tax credit. Okay? And it's in most states. They can charge. I don't know if we do in Wisconsin or not. There's nothing here that tells me they do. Tax credit cannot be applied to the tobacco surcharge. So this number here is going to go up even higher, up to $4,500 more. Okay? This is the tax credit subsidy that I could receive. And this would be the amount that I would pay a year for the premium. Okay? So I look at it and I go, what do I have now? Well, let's do a little math here on the calculator. Pop this sucker up. Right now, I pay $116 every 2 weeks. Times that by 2 to get my monthly amount. So right now I pay $232 a month. Now I'm going to times that by 12 months. So I'm paying right now $2,784 out of my pocket. Is that number less than that number? I guess the Affordable Care Act isn't so affordable to me. Even if I get this subsidy, it's still 56% higher. Okay? And I don't even know if it equals the same amount of coverage as I'm getting with my work. So that would be a good thing to know. Then it goes on down here to talk about you can enroll a bronze plan for about $4,800 per year. Bronze plan, which would be 6.96% of my household income. Well, even this 4801 is almost 50%. It's almost double what I'm paying. It's $400 shy of double. Okay, so I'm guessing around 44, 45%. More still. Okay, down here further, it talks about maximum out of pockets on a silver plan. They can be no more than $12,700. Well, my maximum out of pocket right now for a whole family with my insurance plan from my work is $1,000 a year. That's way less than this. And interestingly enough, I had to have, due to no issues of my own, I didn't do this to myself, but I have diverticulosis. It's no different than a Crohn's disease or a colitis. It's just the most minor of them. But I still had to have a foot of my large intestine removed, and I got to tell you, when you receive medical bills of over $100,000 and all you have to pay is $500, it's unbelievable. It's awesome. I was on disability. I would have never been able to afford this $12,700. So I don't know what craziness is saying that that's even remotely right. So this is just a snapshot, too, by the way, of what I could be in for going to the Affordable Care Act. So this doesn't make me feel too happy about this. Now, like I said, I'm not applying right this second because it doesn't work. Imagine that. So This is a snapshot, guys. Just to give you the heads up. So, it also states down here in this thing, currently about 1 in 4 people, that's 25% of people, use no health care services in a year. 25% of 360 million people in the United States amounts to about 90 million people. So 90 million people don't even use health care. But guess what? Those 90 million people have to have it now, or you face fines. So I don't know what the deal is, but I can also tell you this. The interesting part is we're all going to be paying for this, and I hope everybody's ready for the ride. Now, I get that there are some people that don't have health coverage. I get that there are some people who are less fortunate that don't make as much money as maybe I do in a year. Understand that completely. You know? But why? What's up with this? Why am I now having to pay X dollars now for my family? Why would I have to pay X dollars now for my family? My family is number one to me. Sorry. It just is, as is everybody else's families are number one to them. If they're not, your priorities are messed up. But you take care of your family obligations first, not everybody else in America. And this is just coming from a normal, everyday American citizen, a guy who works his tail off for everything that he has. And my wife works her tail off, too, for everything that we got. So I get that there's something that needs to be done, but this is definitely not what needs to be done. Definitely not what needs to be done. And this is in my opinion. Don't forget. So don't be too big of haters on me. I'm just looking at it in blue and black and a few other colors here. It's not exactly black and white, but it's pretty much black and white. It's numbers here that give me an idea of what's going to happen. Okay? So, freedom, it's all about freedom for me. And freedom lives, man. Freedom lives. Thank you very much for listening.